All right. New year,
Ooh.
new episodes, new us. Not.
Us. Exactly the same.
Welcome back to Scissors and Scrubs. I'm Nicole.
I'm Laura.
And we are doing a whole new year. So what is it, 2025?
It is.
2025. I can't believe it's 2025.
I can't either because I remember when Sam was going into when he graduated his preschool class, they put them on stage and they say, "Welcome to the class of 2025." And they're like, you're like, oh my God, that's
so
never
far
going to
away,
come.
yeah. I can't believe it. I feel like it's like somewhere around 2010.
Yeah.
Anyway, so we decided to start the new year with new technology,
Ooh.
which isn't really that new. I don't like it. It's controversial for me because I don't like it. And I don't have any logical reason why I don't like it.
It's just you're old.
It's just old and I like the old ways.
Yeah.
We're going to talk about robots.
Ooh, robotic surgery.
I guess I kick it off because I have a little bit of the history thereof,
Okay.
robotic surgery. Does that sound right?
Sure.
All right. I got my information from the American College of Surgeons, May 10th, 2023
Okay.
article. Paul, you'll probably like this article because it's very informative and he likes the
It's very
informative.
factual.
He likes the informative
Yes.
ones. All right. So as of 2023, when this article was written, there were 12 million robotic surgeries performed by 60,000 robotically trained surgeons in the United States, or worldwide, I guess. From 2012 to 2018, robotic surgery increased from 1.8% to 15.1%. Now, you know why it increased, and I will tell you later on what saved the day to bring robots into the future, and you know, but people will never guess what
Surgery
saved
is the big
robotic
one?
surgery. Okay, I'm getting over a little cold, or I still have one. The holidays almost killed me, so forgive. All right, so the idea for robotic surgery was born from the U.S. military. Never saw that one coming.
I know.
They were looking for a way, which I think is very ingenious,
Yes.
but I still don't know how this would work. They were looking for a way to bring surgeons to the front lines remotely. So, you're down in wherever and you're injured and the surgeon's in Boston and maybe he can operate. I'm assuming that's what they meant by remotely. So, and they want to bring it to the front lines and they needed a virtual way to bring surgeons to the front lines. So the Stanford Research Institute, SRI, as they will be referred to, developed a prototype. It was a surgeon-controlled robotic telepresence workstation with a remote unit. It was initially developed for open procedures, which I find even more bizarre.
Yeah,
So
that's
this
weird.
robot, you slice it, like it must have been
there was-
working as his arms
Yeah.
completely. It just blew my mind. So for open procedures, but it proved very efficient and Jesus, I'm drinking water.
Laparoscopic.
I'm drinking water.
It's like 3 p.m.
It's the cold. Efficient and laparoscopic procedures for when surgeons needed to work in really tight spaces. And this is something I am constantly asking them because I don't like robots. And for stupid reasons, I don't like them. And they're like the dexterity you get with a robot is 10 times more than you can get with laparoscopic. So Dr. Frederick Mall jumped on the laparoscopic advantage and became known as the Steve Jobs of robotic surgery.
Oh.
And that is a quote. So today we're recording in my house, and I asked everybody in my home to be really quiet, and the exact opposite is happening. So as you can hear, my husband right now is currently taking his shoes off and dropping them on the ceiling. So if you hear a lot of random noises in this episode, it's because we're recording in my house, and we don't usually do that. Okay, so back to Dr. Mall, Steve Jobs of robotic surgery. So in 1995, which I can't believe it was that long ago, he and two partners acquired a relevant robotic technology from SRI, which I mentioned earlier. 2 years later, the first robotically assisted lap chole was performed on a living patient using what they called the Mona surgical robot. His company, Intuitive, competed with another company called Computer Motion. Computer Motion was funded by NASA's Jet Propulsion Lab, and they were interested in developing remote-controlled robots for astronauts, training, and remote operators. So they developed Zeus. This robot combined the camera holder with the laparoscopic component. So apparently Mona did not hold the scope, and Zeus held the scope. So in 2001, a lap chole was performed using Zeus. The two companies competed until they merged in 2003. And the merger means that the new company has dominated the robotic surgical industry. They are the ones who developed Da Vinci. So, as we all know, all new things, surgeons are resistant. Surgeons like the old ways too, some of them. And they're resistant. Why would they be resistant? Because they can't control it the way they want to, because surgeons like control. Mm-hmm. So, it started in cardiac surgery first. They tried it thinking it would be easier to sew in the bypass grafts. But you have the pump machine in and everything, so it didn't...
It's a lot of equipment in those rooms.
Yeah, it was too much equipment, and you're competing with the beating heart, so it was making it very difficult. And so then they just stopped doing it altogether. Then they tried it in general, where many of the surgeons, which I'm not, it didn't really get into this, and this confused me a little bit. The surgeons wanted to prep and inspect and prepare the operative field before they went into the robot, which is what they do now. So for some reason, this was conflicting with general surgery. It didn't really say, so I'm assuming the initial robot was supposed to do all of it.
Do they mean that they wanted to go in laparoscopically and look and see if it was suitable and then use it, and that would be a pain in the neck to do all of that.
And the cost would not outweigh the robot.
Right.
So it looked like robots were going to fall by the wayside because nobody could get their shit together to work with the robots. Until ... the urologists appeared.
Those urologists.
In saves the day, the prostate. The prostate saves the day. Mm-hmm. Who knew that little tiny donut gland would bring robots into the new millennium? So urologists are the first to show that laparoscopic procedures with the robot-assisted approach decreased hospital stays and blood loss compared to open procedures. They did a whole study, and they showed if we do it this way, it's cheaper, which, as you know today with medicine, if it's cheaper, it's better. Mm-hmm. It was popular with GU because it made it easier to work. And the prostate's way down on the pelvis, and it's a very, very tight space. So it made it easier for them to work and get the prostate out easier than a regular scope procedure. Because like I said, the instruments articulate in a way that laparoscopic instruments do not. And it has a 3D camera, which makes it easier for them to see. So they call those wristed instruments. I did not know that. Okay. So in recent years, so they start, and now everybody starts getting robots. That's where we first got them. GU starts doing all their prostates. Now it's becoming popular in general surgery, thoracic surgery, GYNs. Everybody's doing robotics. They want to do robotic hernias, robotic general procedures. They're doing GYN procedures, like all kinds of stuff. The training in the beginning, surgeons took 1 to 2 day workshop to do a case. And like, here's your workshop. This is how Botox was in the beginning too. Here's your workshop. Now go do a case. They'd have a bad outcome. They'd get sued, and they'd never touch a robot again. So today, most residents get robotic training, and there's fellowships in robotic surgery. And one of the GU residents said, some of these programs aren't even teaching the open procedures anymore. They're only teaching laparoscopic and robotic, which doesn't make any sense to me. But we'll talk about that later. So Dr. Vincent from the University of Kansas, quote, the next generation of surgeons are much more competent on the robot than they are on laparoscopic for some advanced. For the surgeons, their benefit is that it allows them to sit rather than stand for these long procedures. But on the opposite thing, they're complaining that they're getting back pain from hunching over. Yeah. And some of them are saying they're having eye strain from looking at that 3D camera for hours on end. The hospitals feel that robots in the long run will save money with shorter hospital stays and better outcomes. There are fewer complications with fewer readmissions, which means less money. And the robot itself is wicked expensive. So to purchase it, you have to have the benefits that outweigh the cost. And they were saying that some of the future aspects that you're going to see with the robot are going to be flexible, snaky arms. This maneuverability will allow these devices to work like a catheter to go through the blood vessels. So it's going to be like an IR procedure with a robot. Or natural orifices instead of the skin. Oh my God. Some of these are going
we do that anyway, the poems and stuff.
It's we go weird. Through. Yeah. The new arms will be able to help perform procedures such as bronchoscopies and colonoscopies. I don't want a robot doing my colonoscopy. I don't. I'm sorry. What if he perfs me?
Well, there's a surgeon there. They can perf you with the handheld.
Maybe the surgeon won't perf me. And I don't know. Digital enhancements They augment reality. The digital analysis of performance and feedback and real-time suggestions will become part of robotic surgery platforms. They will reduce or eliminate the effect of tremors from a surgeon's shaky hands. That's crazy.
Yeah.
While also providing surgeons with a map of the surgical field. If there's a structure over to my right and I shouldn't be messing with it, the robot may be set to not allow me to. Could you imagine the robot's like the aorta's there? Stay away from it.
Yeah.
Stay away from
That's
that.
the aorta. That's the aorta.
So now you're going to have really unskilled people doing surgery. Automated tasks. The robot systems might be able to execute small maneuvers such as suture. So they're going to close the patient now. Given that the anatomy is relatively consistent and identifiable, it's not hard to imagine a time when the robotic system could do a variety of relatively minor surgical tasks. And AI. The prospect of driverless cars makes it quite possible that we will one day see surgeonless surgery. I really hope not.
I hope not too.
AI could review thousands of videos showing surgeons doing the same operation, put those videos into an algorithm, and figure out how to make the steps replaceable by machine. I just think...
Except everyone's anatomy is different.
Exactly. And if they hit something...
Right. There's no surgeon.
There's no surgeon around. Like... All right. Like I say all the time, I'm glad I'm getting out of this career pretty soon. Take it away, Sparkles.
All right. So I go over like what robotic surgery actually is. And I got this from an article by Sherry Christensen from 2022 in Very Well Health. So robotic surgery is also known as robotic assisted surgery. It is the most cutting edge medical technology of modern times. Yeah. It is not actually performed by robots. People think, oh, a robot is doing the surgery. It is not.
Rosie isn't coming in from the Jetsons and doing his surgery.
Mostly the systems used involve a camera and surgical tools that attach to robotic arms on a console. And then a surgeon specifically trained in robotic surgery sits at a control station with a viewing screen and control hand and foot controls and remotely controls the arms of the robot. The surgeon can be performing the surgery in the same operating room as the patient or from a remote location. So they can have the surgeon console, say in the United States, but the arms of the robot are, say in the Middle East, and they can perform surgery on...
You could almost have PAs setting up the whole patient, and then the surgeon operates.
And I'm sure that's what they do in the military.
Yeah, that's crazy.
Yeah. Robotic surgery is minimally invasive, meaning they make very small incisions. They insert thin instruments through them, which saves the patient from a large incision so they don't have to have an open procedure. Without the robot, these are called laparoscopic surgeries.
Right.
The main difference between laparoscopic and robotic surgery is the degree to which the tools can be manipulated. There is a higher level of dexterity, as you said, and a higher range of motion when using robotic technology because there's many... like joints and wrists on these robotic tools that we don't have on laparoscopic and like the human.
Why couldn't you make the laparoscopic instruments like that though?
I don't know how you would manipulate it. Like if you only have like the hand pieces that they hold would have to have all sorts of gears on it to turn all of the, you know what I mean?
Yeah, I guess.
So if you're going for robotic surgery, you go in the room, you go to sleep under general anesthesia, just like any other surgery. The surgeon preps and drapes you like any other surgery. They scrub in. They make little tiny incisions for however many sites they need to get the tools in. And then they attach certain instruments, whatever instruments they need, to the arms of the robot. There's usually like 5 or 6 arms of the robot. And then the surgeon takes off his gown and gloves and goes sits at the console.
Takes his shoes off.
No.
Puts his phone to the side.
So they are not scrubbed in anymore. They then go to the console, and it is literally like a video game console. Yeah. It's like they put their eyes. You know when you go to the eye doctor and you go to that eye test and you put your eyes like right against that machine and you're looking at a screen? That's exactly what it looks like. They're putting their head right to the screen, and then they have hand controls and foot controls to manipulate all the arms of the robot and to have them do all different things. They do whatever procedure it is. There's usually, it depends on the hospital setting. I know our hospital, we always have a PA scrubbed in or a resident scrubbed in or both. So they're always scrubbed at the field and they change out the arms of the robot.
Because the surgeon is sitting with his back to the field.
Right, because you're looking.
He can't see the patient itself. He's looking at the inside of the patient, but he's not looking at the patient. So you have somebody there, like a PA, who is switching out the equipment he needs and keeping an eye on the patient.
And sometimes they need to do apply a clip.
Right.
And you do that. They do that manually through
Right.
a port.
And
They
then
don't
give it
use
to
the
the robot.
robotic arm. So they sometimes have to do things that they're not using the robot for. That's at our hospital. At other hospitals, I know they don't have people scrubbed in.
Right.
So I think the surgical tech or the scrub nurse does that stuff. But anyways, that's how that works. And then when they're done with the case, they scrub back in and they close the patient. So who should not have robotic surgery? Obesity may interfere with the surgeon's ability to perform a procedure robotically, but it depends on the patient's specific anatomy and the procedure they're trying to perform.
Yeah, I wonder if we're going to see gastric bypasses being done.
They do them.
They do?
Yeah. Specific types of surgery cannot really be done using the robot as of now. Like plastic reconstructive microsurgery can't be done.
No.
You need a microscope for that. And even though the camera on the robot is much more in depth than like the laparoscopic camera, it's not enough to do like micro surgery as of now.
They were doing some mouth surgery with the robot.
Yeah.
But it was ridiculous because you have to have a port for the robot. So they had to put all these ports in the mouth. It was ridiculous.
Yeah.
I'm like, okay, that makes no sense to me.
Yeah. The instruments right now are like too big. The surgeon's view can't be magnified enough. So you can't do anything like micro right now.
Mm-hmm.
Specific risk factors should not have robotic surgery. It should not be performed in a critically ill patient who needs emergency surgery or trauma patients.
Yeah, no. Imagine trauma coming in. Let's get the robot. Hold on a minute.
I can't even.
It's going to take 20 minutes.
Certain comorbidities, patients with cardiac issues, extensive adhesions, or other medical conditions may not be candidates for robotic surgery. The benefits of robotic surgery for the patient: the improved dexterity allows access to difficult to reach places. So it's less traumatic to the tissue surrounding where you need to go if these robot arms can get in there. There's better visualization of the surgical site due to the magnification of the camera. There's less fatigue for the surgeon, like you said. It eliminates the surgeon's hand tremor, which is a common phenomenon, especially during long cases. Yeah. If you're doing the same thing over and over and your hands are holding instruments and squeezing things, you get a tremor, and this eliminates that. Like you said, it's shorter hospital stays, faster recoveries. There's less risk of infection. There's less blood loss. There's less pain and scarring. There's less time post-op for patients to return to regular activities and function. The risks: there's a potential for human error. Mastery can take anywhere from 20 cases for like a tubal ligation to 250 robotic surgeries for like a prostatectomy.
Right. And then you can talk the difference of hours too. If a new person on a robot for like a hernia could be hours.
Yeah. There could be mechanical failure. That the robot is a machine. Mm-hmm. It can fail. We have like our kits all come with like these keys in them. In case an arm does freeze and the instrument's stuck on the thing, we have an emergency release key, but it's still, there can be mechanical failures. And nerve damage from the robotic arm. Like if the robotic arm is leaning on the patient, you don't really know that. Right. Because it's leaning on the drape and you can't really see that. So it can cause compression, which can cause nerve damage. The most commonly performed robotic procedures are under general surgery: gallbladder removal, gastric bypasses or banding, lap Nissens, which are for if you have like severe reflux, pancreatic surgeries, and liver tumor resections.
Oh, I wouldn't like that.
No, it's a lot of bleeding
in livers.
Head and neck surgeries to treat tumors of the throat or tongue and thyroid cancer. I can't even fathom having a robot like in your neck. Like it's
so not a big space to begin
right,
with, and you have to put these stupid trocars in. So it doesn't.
I don't know where they're going with them.
Right, and the nerves in there and everything. Yeah. Oh my god.
Colorectal surgery. We do a ton of colorectal surgery with the robot to treat colon cancer, Crohn's disease, etc. We do like a lot of bowel resections with the robot. Urological surgeries, like obviously prostatectomy is number one.
Saved the day. Prostate saved the day.
Urinary incontinence and total or partial kidney removals. We take kidneys for transplant with the robot. Mm-hmm. Like if I was giving my kidney to my kid, they could use the robot to take my kidney out.
You're not going to give it to me?
Maybe we'll see. Gynecological surgeries like total abdominal hysterectomies, oophorectomies, which is taking your ovary out, tubal ligations, which is also crazy to me.
Yeah.
ovarian cystectomies. Like they can do all these cases. Anything that you can do laparoscopic, you can pretty much do with the robot. Thoracic surgeries, they do esophagectomies, they do lung wedge resections, they do lobectomies. Heart surgeries, they do valve replacements a lot. And they also do now do CABGs, coronary bypasses, which is what they first started to do, decided they didn't like it, but now they do use the robot for that. And we do use robots on orthopedic surgeries like total hips or spinal surgeries. It's a different robot though.
Right.
It's like a one arm that it kind of does the cutting with the saw. It makes it the angles more precise, the cut's more precise.
And that I can almost get behind.
Yeah, because it's like a precision, it's going to be cut at the specific angle you want.
Exactly how you need it.
Yeah. Before having robotic surgery, go over the risks and benefits of the robot with your surgeon. I know we got the robot originally because patients were demanding that they have robotic surgery. You didn't even know what it was because the surgeons at this hospital didn't even use it.
Right.
And you were demanding it. And I'm like, you don't know.
And they were going to go other places to specifically
just to have the robot. And I'm like, that's fine. You can have robotic surgery, but go over like, what is this? How is this going to benefit me? Mm-hmm. What are the risks? Just know, and also find out how many has your surgeon done?
Yeah.
How many robotic surgeries has your surgeon done?
You really want to know that, yeah.
Who's scrubbed into the case? You're not physically scrubbed in. Who's scrubbed into my case?
How many open have they done? Because if they hit something and they need to go in, do they know how to fix it?
Right.
That way.
Do they also do open procedures? Right. Any surgery, educate yourself on what you're getting into, what are the pros and cons, and make a decision that way, not just because, it's a new
procedure,
new thing to do.
That's the problem with even the drugs. They market, when you're watching TV at night, clearly they know their audience because it's drug after drug after drug after drug. These patients have no idea what these drugs really do or why. And they're going to their doctors. I want Farxiga. I want Ozempic. I want Wegovy. And you can sing the song and tell them I don't think that should be allowed, to be honest with you.
I know.
You know what I mean?
Why? I don't understand why.
Money. It's all coming down to money. So the reason I don't like them is it takes all the fun out of surgery.
You're not involved.
We're not involved at all. I love a big open case.
Yeah.
It's terrible now. These robots take all the fun out of it. Mm-hmm. It's mind numbing for the people who aren't in the hood performing the surgery. I'm very curious to see, because insurance companies don't like to pay. And I get it for some of these procedures, but like you said, a tubal ligation. Are they going to pay for a robot to do a tubal ligation when a surgeon can do it in about 10 seconds, laparoscopic, and probably use less ports? Some of these things, I wonder if insurance are going to evaluate them after so many years and be like, we're not paying for that.
Yeah. I mean, I think it definitely decreases the hospital stays for
certain ones.
Tubal ligation, not staying in the hospital anyways. Right. But I think for certain things it does, so that probably decreases. No matter how many things we need to open for the case, it's still going to be cheaper than them staying.
But that's what they're going to be weighing out. How much is it to perform it versus how much is it not to? And because they really, who's dictating your care? Insurance companies are dictating what you're going to get. Speaking of insurance companies, we're going to cover that little CEO guy. Wow. Just more opinion in the news, nothing factual here, no articles. But that was crazy. Yeah. And we're talking about the Luigi. What is it? Luigi? What's his last name? Who just decided to blow I don't even know how he knew who he was, but blew away the head of the United Healthcare system.
He knew he wasn't Stockton.
Right.
Because he wasn't in a normal, he was in a very specific, right, like a one day thing. So he had stalked him.
And what kills me is that people are making him a hero. I get why he did it. I know people are frustrated with insurance companies. I completely understand.
Yeah, so that doesn't mean you can kill somebody.
You cannot kill somebody.
No. Write to your legislation.
Find another way.
Write to your congressman. Write to your representatives. Right. It's going to take forever, but you can go about things.
It didn't help either that they were talking about capping anesthesia the same week this happened. Do you remember that?
That was after he.
And then all of a sudden they said they're not going to do it. Yeah. As soon as he's get killed, they're like, we're not going to do that anymore. No. So, I mean, do I think the insurance companies have to be reined in? 100%. It's out of control.
They're brutal.
They're sending people home who can barely walk because they don't want to pay for rehabs.
My son's like, why? What is the point of it? I'm like, you're right. What is the point of it? Because they won't cover anything. You can't, if you need to go to a specialist, but outside of the thing, they won't cover it, but you can't get it done inside of your, but it's ridiculous. It's nuts.
I mean, it's as stupid as for years, I've been able to get my compression stockings through my insurance company. Recently, my husband's insurance changed They won't do it to me now because it's my deductible's too much, and they're not gonna. I can't get my stockings covered. That I've been getting covered for 29 years,
which prevents back pain,
Right.
which you need medicine for, which prevents varicose veins that you need surgery for, which
they won't cover it.
it like lowers.
And how much do you think it is? It's stockings,
Right? But I'm saying it lowers the actual overall cost that you're gonna use your insurance for if you develop anything.
Yeah.
Yeah, it's
ridiculous. I remember them sending my aunt home because they didn't want. First, they moved her from the hospital she was in because it wasn't in network, and they sent her to a shithole, and then they sent her home with a Foley, hadn't pooped in 2 weeks, she couldn't walk, she couldn't do anything. And I said to the nurse that was talking to me, I'm like, "Were you a nurse in a hospital?" She's like, "Well, yeah." I'm like, "Well, what kind of nursing did you do? Because what you're doing to her is sinful. Like, I can't believe you would never send a patient home like this. It's the money's not coming out of your pocket."
No.
But I'd love to know where they find these people that make these calls.
It will not. They have nothing to do with medicine.
It's well, they have some of them have like RN behind them. But did you touch a patient? Do you have any compassion at all for what you are declining? It blows my mind.
Yeah, it's just not. It's more and more expensive. Like every year, insurance gets more expensive, but you get
and you're getting less and less.
Yeah, like
Exactly.
It's nuts. Like there's a problem, but
pretty soon we'll be operating on ourselves. They'll be like, "Oh, here's your instruction manual. Here's your robot. Do your own lap happy and you can recover at home." Oh, okay. Great, excellent.
Yeah, that's
bad. That's our New Year's Eve episode. Robots. I'm sure if write in if you know of any other new things they're doing that we may not have heard of. I mean, the East Coast tends to be 10 years behind the West Coast with technology for some reason. We like our old ways.
Yeah.
So happy New Year. Hope
Year.
you guys had a wonderful New Year's Eve, et cetera, et cetera. And we will see you next week.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.